Medicare can be confusing, but it doesn't have to be. When you hear the term Medicare, it usually means Original Medicare. This is the federal health insurance program that helps pay for some medical services for people 65 and older and younger people with specific disabilities. The program helps pay for services such as hospital care, doctor's visits, prescription drugs, skilled nursing facility care, home health care, and preventive services. Well, partner, Medicare's got 4 parts. Each can be combined to help you get health care coverage that's just right for your needs and wallet. First off, there's Part A, hospital insurance that helps you cover inpatient visits, skilled nursing care, hospice, and even home health care. Then there's Part B, the medical insurance that helps cover all sorts of outpatient services from your health care providers. Not to mention durable medical gear, home health visits, and a heap of preventive services. Part A and B together make up what we call Original Medicare, coverage that lets you saunter into any healthcare provider that accepts Medicare. Now, Part C, that's the Medicare Advantage, a spiffy version combining Part A and Part B with a dash of extra perks like dental, vision, and hearing coverage. It's like getting a shiny new badge and spurs. Lastly, there's Part D, the prescription drug coverage, making sure your medicine doesn't run out. Reckon you can either join up with a Medicare Advantage plan that includes your drug coverage or mosey on over for a standalone Part D plan.
Original Medicare may just be the tip of the iceberg when it comes to your healthcare needs. The vast expanse of medical costs can surprise anyone. That's why many enroll in a Medicare Advantage plan alongside their Original Medicare coverage. Medicare Supplement Insurance Plans, also known as Medigap plans, are another option to help fill the gaps of Original Medicare coverage. Tread carefully through the maze of choices, for the path splits into 2 distinct worlds. One cannot travel both the world of Medicare Advantage and the kingdom of Medicare Supplement plans at the same time. Know your needs to ensure you choose the path that aligns with your desires. Behold the 3 Ps, guiding stars in the night sky of healthcare decision-making. The first P begs you to consider providers. Will you have the freedom to consult with your chosen healers without needing referrals? The next P, pharmacy. Will your prescriptions be readily accessible without the toll of deductibles? Lastly, plan value. Will you be left with ample coin in your coin chest each month? Like treasure waiting to be found, Medicare Advantage plans extend beyond mere medical coverage. They bestow upon you dental, vision, and hearing coverage, while also unveiling the wonders of fitness programs, telehealth services, and more. To qualify for Medicare Advantage, must be entitled to Part A and enrolled in Part B as of the effective date of coverage under the Medicare Advantage plan. Will still be enrolled in the Medicare program. Will keep their Medicare rights and protections. Will still receive all Medicare covered services.
Listen up, kid. Medicare ain't just some run-of-the-mill operation. You have to decide, and timing is key. Picture this. You're turning 65 soon, and suddenly, you're in the Medicare game. That's when your initial enrollment period saunters into town, a 7th-month stretch that starts 3 months before your birthday month, includes your birth month, and sticks around 3 months after the candles are blown out. But say you're already tied up with a Medicare Advantage plan during the annual enrollment period. You got options, see? You can cut ties with that plan and go back to the original Medicare scene, or maybe you're itching for a change, a different kind of adventure. This goes down between October 15th and December 7th every year. Then there's the Medicare Advantage open enrollment period, a narrow window from January 1st to March 31st. It's your one shot to shake things up. Swap from one Medicare Advantage plan to another, or slip out of that scene altogether and return to Original Medicare. Coverage kicks in come the first of the month after you make your move.
You can also make changes to your coverage throughout the year if certain events happen. These events could include
if you are eligible for both Medicare and Medicaid, if you lose your current plan, if you move to a community where your current plan is not available, And don't forget about the Medicare Supplement Insurance Plan initial enrollment period. A one-time 6-month spell that starts the month you hit 65 and when your Medicare Part B coverage kicks in. During this stretch, you can snag coverage without penalties or pre-existing health condition clauses breathing down your neck.
The most important thing to remember when considering your Medicare options is that you don't have to go it alone. A qualified agent can guide you in finding coverage that meets your health needs and finances with no cost or obligation.